everyone. My name is Grace Lee, and I'm a senior analyst on the Infectious Disease Infrastructure and Policy team here at ASTO. State and territorial HAI-AR programs play a critical role in HAI-AR prevention and control. Several significant federal investments have been made for HAI-AR programs during the COVID-19 pandemic, which has reshaped how healthcare and public health professionals respond to HAI-AR threats. HAI-AR programs need support from their state and territorial health agency leaders to meet the requirements of these new federal investments. That's why ASTO has developed a report highlighting 8 ways health agency leaders can support HAI-AR programs. In this interview, I'm speaking with Erica Washington, the HAI-AR program coordinator for the Louisiana Department of Health, and the Louisiana State Health Officer, Dr. Joseph Cantor, to talk about 3 of these 8 strategies, specifically how health agency leaders can connect with program staff, reassess organizational structure, and align programs and activities with HAI-AR programs. Erica and Dr. Cantor, from your perspective, why is now the right time to assess the program operations for state health agency HAI-AR programs?
The COVID-19 pandemic really made glaringly apparent gaps that we saw in infection prevention and control. But then also, now we're seeing a couple of other fallouts, specifically with antibiotic-resistant pathogens, unfortunately. So now is really the time to, keep the momentum that we have with our public health infrastructure and to really keep those tremendous gains that we've had with increasing our public health workforce, as well as the investment that we've made across the provider spectrum with those competency buildings and trainings, as well as prevention and response efforts.
So many people worked so hard throughout the COVID pandemic, and it touched, so many facets of our department. For example, the HAI team is one team in particular that has been doing this type of work for years and years, oftentimes in the background, not getting the recognition that they certainly deserve. The size of their team really ballooned considerably during the COVID pandemic. We started with 1 or 2 people before the pandemic and now have close to 20 people. A real blossoming of the team as their work really increased and as the importance of their work became more noted. That said, because of the requirements of the pandemic response and what the team was dealing with, helping healthcare facilities, hospitals, and nursing homes in particular, control the spread of the virus, all the other work that the healthcare-associated infections team has done in the past, perhaps was on the back burner or wasn't the forefront that it had been before, but it's vitally important work. Work of preventing unnecessary use of antimicrobials, preventing resistance, that type of slow, methodical work that we know is vital, we know will pay dividends down the road, needs to be reinvested in. And so I think now is a great time to be shaping what that reinvestment looks like and shaping what the team looks like to help do that work, because those problems are not going away and they were likely exacerbated through the course of the pandemic.
Thank you both for your answers. SHARP funding provided states access to necessary resources for comprehensive HAI-AR programs, including outbreak response, prevention, training, laboratory surveillance, and stewardship. Dr. Cantor, how is HAI-AR program strategic planning being included or aligned with overall state health department strategic planning?
I think the challenge for us and departments like us is, first how to use funds like this wisely, but then how to integrate that in a sustainable fashion when the grant funding runs out. This funding is going to give a good relaunch, so to say, to the team, help us bolster up, and to be honest, help us rebuild from the COVID-19 pandemic. It's on us to find a way to substantiate this work after the grant period goes, and that's the work that we're doing now. I think if you ask healthcare institutions, they'll tell you this type of work is incredibly valuable to them. What we offer to them through a program like this is non-regulatory, non-disciplinary technical expertise. Ideally to catch issues and help with problems before it becomes a regulatory issue. and healthcare institutions find that incredibly valuable. So it pays for itself in that regard. It's up to departments to figure out a way to structure that so that the funding is there to support the work.
Thank you for providing those examples, Dr. Cantor. Erica, you've been involved in conversations regarding current and future responses to multi-drug resistant organisms and HAI-AR outbreaks within your jurisdictions. How is strategic planning within your HAI-AR program driving these conversations in Louisiana?
Strategic planning is driving the conversation in the Louisiana Office of Public Health's HAI-AR program because having a multidisciplinary team at this point, it really is required because we have lofty goals that are achievable, but we really want to make sure that we look at our metrics and hold ourselves accountable to both our internal and external stakeholders. We're fortunate to have a multidisciplinary advisory committee that help us to look at what goals we've set with regard to antibiotic resistant threats, how we're working to reduce those threats, where we're making prevention priorities, how those threats are distributed within our state. So strategic planning, is definitely something that we do on an annual, but also a mid-year check-in. And it's goals oriented as well as metrics based. So we definitely look at how we're making progress towards not only our statewide, but also our national goals.
Thanks for sharing, Erica. Dr. Cantor, how does a state health official bring together the strategic plans from programs across the agency to be sure planning efforts are aligned and collectively headed in the same direction?
Well, I think you have to make the investment. You have to recognize the need for this and build it into a budget. But, after that, I do think it's the role of leadership to advocate for this type of work and to advocate fiercely for it. One of the challenges of teams like HAI teams is when they're doing their job well, it's often unnoticed. It's in the background. It only becomes apparent when issues arise. If they're working at the top of their game, generally people don't know about it, and that's good. That means you have to sell it. You have to advocate for it. You have to make sure that those who are trusted with funding decisions, legislators and so forth, understand the value and understanding the work that's being done, even if they can't see it.
Thanks for sharing, Dr. Cantor. Communication pathways between HAI-AR programs and state and island area health agencies are vital to supporting and promoting HAI-AR programs' capacity building and sustainability. The COVID-19 response further emphasized the need for this robust two-way communication, which is one of the 8 strategies outlined in ASTO's report. Erica, what successes or challenges did your HAI-AR program experience during the COVID response, and how did you engage with the state health official?
So for communications and response, we were very fortunate to have a very supportive and responsive state health official, Dr. Joseph Cantor. And I think that the biggest success that we can really cite is our long-term care office hours. They actually kicked off in April of 2020 with the assist of our Division of Healthcare Quality Promotion at CDC. That's the division at CDC that really supports and provides subject matter expertise for HAI-AR programs. And then from there, I really carried it forward weekly. At this point, it occurs bi-weekly, but I think that the biggest success is having providers understand that and know that someone is going to be available at this point every week in a very dynamic environment, just being available to answer questions, provide content and knowledge, and review of guidance and reinforcement of concepts. The HAI programs are definitely being seen as important partners whenever anything happens in healthcare settings. So I think that the expertise that resides in HAI programs is definitely being understood within our health departments, but then also outside for our partners as well.
From the perspective of a state health agency, I'd like to hear how continued engagement is crucial for HAI-AR program visibility, sustainability, and growth. State and island area health agencies play a vital role in amplifying and aligning with HAI-AR program priorities. Erica, what is the most important thing you have learned about the role and value of your HAI-AR program, and how it has helped Louisiana the last couple of years?
The most valuable thing I've learned about the HAI-AR program is our attention to prevention. Um, we are very proud of the fact that we actually launched a viral respiratory diseases detection and containment workshop in 2019. And that was because we were looking at flu disease burden and long-term care, and that was actually before the COVID pandemic. It was a cross-cutting activity that worked with our viral respiratory diseases program and our infectious disease epidemiology section in the Louisiana Office of Public Health. But really, our attention to prevention is really something that I've understood has really been of value and treasure for our program. I think that response is definitely understood and valued as well, but really how we really sew into facilities through education, constant training, that's really a key component of our Project First Line activities, how these professionals go out and do a lot of targeted trainings, assessment of gaps as well, and how we use our outbreak data to actually address these gaps and do continued education as well.
The HI team was integral to the COVID response. One of the things that I think helped us is the way that we reached the stakeholders. I think this more antiquated way was just to connect with the main representative at a healthcare institution, for example, the HII program manager at a hospital, for example. And sometimes that was effective at reaching the folks further deep in the organization that we had to. Sometimes it wasn't. One of the things that we learned throughout the pandemic was to make strides to make the communication connect with people, not just our immediate counterpart in that institution, but to build connections deeper into the org chart, to build connections directly with frontline clinicians, for example, to make office hours and educational opportunities available to them directly, to not just rely on the point of contact for that institution, to really delve deep to make sure that we're connecting directly with frontline clinicians.
Thank you both for sharing your thoughts and experiences on how HAI-AR programs and state and island area health agencies can maintain and deepen their engagement to ensure the safety of patients, healthcare workers, and the public. The continued partnership between HAI-AR programs and health agencies is critical in spearheading infection prevention, detection, and response efforts, both for current and future outbreaks. I encourage you all to check out the ASTA report titled 8 Ways Health Department Leaders Can Support Effective HAI-AR Programs for more insight on how health departments can prop up HAI-AR programs. Thank you.